The Minister of State for General Duties in the Ministry of Health, Hanifa Kawooya, has sounded the alarm on the need for urgent preventive measures against the spread of tuberculosis (TB) in Uganda. Speaking at the annual Tuberculosis and Leprosy Conference 2024 in Munyonyo, the minister emphasized that the current treatment-focused approach has resulted in a significant financial burden, with a lot of money being spent on treatment.
Prevention is better than cure. Why are we moving into prevention? Because these are the diseases that start at a community level. And these are the diseases that we need to educate our communities, to reach out to our communities and emphasize that these are the diseases that once you know that the diseases are prevented and you guide them.
In 2023, at least 96,000 TB infections were detected, with males below 15 years accounting for 52% and females accounting for 34%. Alarmingly, 14% of these cases were children.
Mainly is that 60% of the patients we detect are men. So we are having more TB among the men than compared to females. So we need to make sure that we put in place programs that can address the high prevalence of TB among men. We need to be able to reach men from where they are and screen them for tuberculosis and treat them.
Despite efforts to combat the disease, TB remains a significant threat to global and national health. The minister stressed the need to focus from treatment to prevention. She also highlighted the importance of community engagement in combating the spread of TB.
There are things that we can emphasize on from community. So our health policy now is more community-based and community participation. The moment we participate with the community, it becomes easier for us as the health sector and everybody that we are owners. Because health is something important.
She, however, called for the use of quality data to identify and tackle TB cases for proper diagnosis.
Be actual, factual data. Now, after collecting that, which is factual data, that yes, there is a disease here. Most of our community will say, like now when we are having mpox, you cannot address issues of mpox unless you have the collective data. How many people have been affected, how many people are still there, then it traceable. Data will allow us to trace the patients.
The spread of TB requires a multi-sectoral approach involving different stakeholders to help fight the spread and manage the mental well-being of patients. Organizations like the AIDS Healthcare Foundation, Uganda Cares, have been at the forefront of providing special care and treatment to patients living with TB since 2002, as Dr. Augustine Lubanga narrates.
Achievements have been in ensuring that all people living with HIV, for instance, the 153,000 that are in the care of HF Uganda cares have been over 90% of those have been given TB preventive therapy that kills the TB before it comes out to cause the disease. And it is one of those successes that have reduced the TB burden among the HIV patients. So for today we come out to reflect as stakeholders in the fight against TB to see where are we, how are we performing across the targets that we are given to us.
However, despite these efforts, there are still numerous challenges that need urgent attention.
So, first of all, diagnosing TB is not yet easy when we compare to other diseases. There is a green light, new technologies are coming on to ease that. But For us, the gold standard tests are not yet available everywhere in the country. So when we talk about gene expert machines, we talk about the mobile X-rays and so on. They are not readily available, but there is hope. We've been promised that more of those are going to be procured and given to health facilities.
The quality of care. When you have a patient who is sick with TB and you put them in treatment, what is going to kill them may not be the germ of TB. They may die from a complication of the disease. Yeah? They could bleed, they could become dehydrated. So that simple care, bedside care of a sick patient is very important to improve the outcomes of TB. And this is how we are going to be able to reduce the TB mortality. The good thing for Uganda, we have cut TB mortality actually by 50% in the last 5 years. Yeah? We used to be in double digits, but we are now going to single digits.
The minister's call for urgent action to prevent the spread of TB is a step in the right direction, and it is essential that all stakeholders work together to address this significant public health concern. The annual Tuberculosis and Leprosy Stakeholders Conference is aimed at advancing multi-sectoral and engagement and accountability to end TB and achieve zero leprosy in Uganda. Nagujja Serena, NSTV.
You're trying to get out of the goal now.